So, let's say early 2021, vaccine is available. There is a long way between vaccine being available and vaccine actually being able to be administered to, essentially be made available to everybody in Chicago. At the beginning, this is going to be prioritized. It'll be available probably for healthcare workers, depending on how the trials play out. There will be some prioritization likely of, older people who we certainly know have been at the highest risk. It probably won't be available for kids right at the beginning. There will be additional trials for women who are pregnant that need to happen. It's going to be a process, even after a vaccine is available. Even the logistics of this, I think it's looking like good chance we're going to need a couple of doses of this, and that doubles the number of glass vials and syringes and procedures, and it's going to be an enormous lift in Chicago and around the country to make this vaccine available. So that's going to be at least a year, and during that whole time period, we're going to continue to need to protect each other. Yeah. So masks are with us, and that's why, I said this morning to somebody that we're having a lot of conversation around things like school reopening, and I totally understand this is a difficult conversation. If COVID were going to be over in a month or two, this would be an easy decision, right? Of course, we would all hunker down and wait 2 months, but it's not. This is going to be couple of years, realistically. At the health department, we're planning 2 to 3 years where we think about sort of the COVID response. And throughout that whole time, yes, we'll be working toward this, but the vaccines, it's not going to be 100% protective, most likely. And even as more folks are getting vaccinated, there probably will be some people who decide not to get vaccinated. There probably will be some people that will be waiting on trials for pregnant women, for example, right? You'll want to be extra sure that that vaccine is safe before it's available. And so for all of these reasons, we're going to need to continue to do the things that protect each other while we continue in our new normal. So I wish I could say that COVID were, going to be over shortly, but it's not. And us doing everything we can to support folks who are at higher risk, not have an outbreak that's out of control, lets us be more open and have more possibility for the things that everybody enjoys here in Chicago.
Yeah.